Hi guys, welcome to this screencast on the additional factors. What I've tried to do here is put every single additional factor into this one screencast. So you've got additional factors of the skeletal system, muscular system, respiratory, cardiovascular, and the energy systems as well. So be prepared in the exam for an additional factor to be one of the questions. However, which one, I can't tell you unfortunately. So first of all, the skeletal system. So additional factors. Can you identify the three additional factors affecting the skeletal system? There is a fill in the blanks for you if you pause this and give that a go. You should have arthritis, osteoporosis and age. We're going to go about arthritis and osteoporosis in a bit more detail now. So arthritis, what is it? Can you fill in the gaps there? And how does regular exercise help prevent arthritis? Think back to the responses of the skeletal system. Okay, it'll help you with this question. With regards to the fill in the blanks, it's arthritis is inflammation within a synovial joint. So this is synovial joint here. Inflammation within this joint is known as arthritis, and it causes pain and discomfort. Okay, when you get a question in the exam on the synovial joint, it might be explain the shoulder joint. Well, it's ball and socket joint, synovial joint. Within that, okay, there's a large range of movement. Within that, you also have to discuss these things that are here as well. Okay, you have a bursa. What's a bursa? Explain that. You have articular cartilage. What's the purpose of articular cartilage? What's the purpose of synovial membrane, synovial fluid, and so on. So back to this. Can you answer that for me if you press pause and give it a go? Okay, so it increases production of synovial fluid. This means the joint is more lubricated, which reduces friction between the bones, increasing increased minerals to the cartilage, resulting in a healthy joint. So this is the cartilage. This is what becomes inflamed and causes arthritis. Regular exercise will essentially help the whole joint to stay healthy. Osteoporosis. Fill in the gap, see if you can do that for me. How does regular exercise help prevent osteoporosis? So up here, it's the weakening of bones caused by a lack of calcium. That's what osteoporosis is. A lot of older people get osteoporosis, so be aware of that. How does regular exercise help prevent osteoporosis? Think back to your responses again. Mineral uptake, okay, so more calcium because of mineral uptake. More dense, stronger bones, that's going to reduce the risk of injury, okay. So pause this and give that a go, then we'll go through the answers in a minute. So weight bearing exercises, e.g. running, that'll get you 1 mark. E.g. running, you have to give an example. You can't just put weight bearing exercises, you have to give an example. And then here you've got weight bearing exercises which stimulate the bones to take up minerals such as calcium. This will reduce the rate of bone loss, helping to maintain bone mass by making the bones stronger. Absolutely fine, except any of the appropriate answers. So if you just said weight bearing exercises to stimulate bones take in minerals such as calcium, this will make them stronger, which will reduce the impact of injury or the effect of injury, such as a fracture. I'm sure that would be okay as well. Okay, so the muscular system. So age and cramp, that's what we're focusing on now with regards to the muscular system. Again, there hasn't been many particular questions on these. I'd focus on cramp more than age, in all honesty. However, it's important that you know both. So go back to the PowerPoint that's on Moodle to help you out with this. So fill in the blanks. This is about cramp. So what is cramp? How do you prevent it? What causes it? Give that a go, pause it. Okay, you should have cramp is an involuntary sustained muscular contraction. Okay, now you've got to understand that it prevents muscle movements, causes dehydration, lack of salt. Now, regards to the causes, you have to understand, when do people tend to get cramp in sporting events? Towards the end of the game, i.e. they've sweated a lot, then they haven't been taking in much water, they're dehydrated. It's a cause of cramp, dehydration. Lack of salts, we get salts from electrolytes in Powerades, for Lucozade, etc. They have electrolytes in, which give us these salts that are important. That's why people take Powerades, for example. Sonya's a football player in a cup final. The final has gone on into extra time, as I said, towards the end of the game, and she develops cramp in her leg. Explain how cramp will affect Sonya's performance. Pause and give it a go. The answer you should have is, first of all, explain what cramp is. Cramp is an involuntary sustained skeletal muscular contraction, which prevents muscle movement. 2 marks for that, which occurs due to dehydration or lack of salt. 1 mark. This prevents the footballer from running pretty forward or kicking the ball. Self-explanatory. You should know that from common sense. You know that cramp comes at the end of a game. It's because of dehydration. You should know that cramp makes sure that you can't have a muscular contraction. Okay, it's an involuntary sustained muscular contraction, and then finally, it's going to prevent you from actually taking part in a sport, i.e. running. or kicking a football. Keep it really simple. Respiratory system, we've got these two here. Fill in the blanks, give them a go. Okay, you should have asthma and effects of altitude, partial pressure on the respiratory system. These two are a bit more complicated, okay, and I'll suggest potentially looking at the effects of altitude in a bit more detail, okay, out of all these additional factors. I don't know why, don't take my word for it, however, it came up in one of the exams, but it didn't come up in January. It's a tough question, that's why I think they may ask it. So, discuss the effects of participating in swimming on the respiratory system for an individual suffering with asthma. 6 marks. Negative effects of asthma. You've got to link asthma with cold conditions. Okay, that's how we get our memory method. Asthma, cold conditions, winter, turn winter into winter, and we have wheezing whilst breathing and coughing, inflamed bronchi, narrowed airways, feeling of tightness in the chest, exercise-induced asthma, reduction in the amount of air able to get into the lungs. They are the negative effects of asthma. That is why you do not want asthma. It's why it's negative. It's why it's important. We kind of try and prevent asthma. This all means the net effect is not enough oxygen into the lungs, therefore decreased amount of oxygen supply in the working muscles means that the athlete will not be able to perform at high intensities for a long period of time and you'll fatigue early. Because it's discussed, you've got to also discuss the positives. Okay, so exercise strengthens the respiratory muscles, we should know that, okay? It's an adaptation to the respiratory system. Increases in vital capacity, again, that's an adaptation to the respiratory system. Helps to reduce the effects of asthma. These mean oxygen uptake is improved. More oxygen to the working muscles, perform for longer at high intensities, reducing fatigue. So here's an exam question. Julie's an 18-year-old swimmer and has asthma. Discuss the effects of participating in swimming on the respiratory system for an individual suffering with asthma. 6 marks. Asthma, cold temperature, winter. That's the answer, the one we've just gone through together. Altitude. So altitude training, what is it? Okay, it's training over 2,400 metres or 8,000 feet. You're not necessarily going to need those measurements. You're just going to need to know what altitude training is. It's training at a high kind of altitude, for want of a better word. Countries: Peru, Colombia, Switzerland, anywhere in in Africa pretty much is at altitude, and South America. Hypoxia, this is really important. If you get asked a question about altitude, you need to use the term hypoxia, which is basically the deficiency in the amount of... Well, hypoxia is altitude sickness, sorry. Hypoxia is that headaches, feeling of nauseous, dizziness, headache, shortness of breath, so on. That is what hypoxia is. It's the deficiency in the amount of oxygen reaching the tissue. The higher up you train, the higher up at altitude you are, the less oxygen that's available for you to breathe in. Therefore, you're going to tire easier, you're going to get headaches, you're going to feel dizzy if you do kind of maximum exerted efforts for a long period of time. These are the advantages of altitude training, these are the disadvantages. Have a look at them, get them down. I'm not going to go through them, so pause this and get them down. This is the important part, okay. Describe the initial impact of altitude on the respiratory system. Now, you won't necessarily put 2 and 2 together. However, when you are talking, if they ask you about altitude, they're going to want you to mention about partial pressures of oxygen and so on. So you're going to have to mention gasp DD, or you're going to have to think of gasp DD when it comes to altitude. Again, thinking of altitude, if the oxygen's low or really, really, really high in the air, you're going to be gasping for air. And the memory method we use is gasp DD, ADD. You also have to remember you're going to have to start it with hypoxia. First of all, describe the initial impact of altitude on the respiratory system. Well, first of all, the athlete is going to suffer from hypoxia, which is a feeling of dizziness, sickness and headaches. Then you have to go into your gasp DD, ADD effects. We're going to go through that now together. So just a reminder, hypoxia, deficiency of oxygen reaching the tissues, makes you feel lightheaded, dizziness, sick. The gas is oxygen, we're talking about area. Okay, we're talking about the alveoli and the blood, i.e. oxygen getting from the lungs into the bloodstream, and then we're also talking about oxygen going from the blood into the muscles. Partial pressure, there's a lower partial, it's not a low partial pressure, we have a lower partial pressure of oxygen in the air than at normal sea level. So when we're training at altitude, there's a lower partial pressure of oxygen in the air, therefore in the alveoli, because we haven't been able to breathe as much in. Diffusion gradient, we have a reduced oxygen diffusion gradient from the alveoli to the blood. Diffusion, reduced oxygen diffusion from the alveoli into the blood. Association, oxygen and hemoglobin association is reduced. What I said to you regards to this in lesson, if you remember, is you associate yourself with something. You associate yourself with your mates. That's who you associate yourself with. Oxygen associates itself with hemoglobin really easily. Remember, hemoglobin carries oxygen within red blood cells, then it goes to the muscle and it's fine. Well, at altitude, this association between oxygen and hemoglobin is reduced, so not that much oxygen actually attaches to hemoglobin. So the gas DD, ADD, the diffusion gradient, reduced oxygen diffusion gradient between the blood and the muscle, because we've had a reduced here. So now oxygen is travelling in the blood, we haven't got much of it, so we've got reduced oxygen diffusion gradient between the blood and the muscle. Diffusion, reduced oxygen diffusion from the blood into the muscle. What does this mean? The effects, breathing frequency increases, stroke volume decreases, which causes heart rate to increase. As less oxygen is delivered to the working muscles, there is an earlier onset of fatigue. When it comes to this question in the exam, if you have a question on altitude, as long as you can kind of realise in your head, you have to talk about hypoxia first of all, which is the deficiency of oxygen reaching the tissue, and it's about headaches, dizziness, feeling of sickness. As long as you can suggest that you're not getting enough oxygen on board, which means you're going to fatigue or cramp early, you're not going to be able to perform for longer, higher intensities and so on, you'll get some marks. If you remember all of this process, you're going to get 4 marks, which would be absolutely brilliant. So GAPS DD, ADD, that's your memory method you need to use for that. So the weakest part of Evan's triathlon, of his running section, to improve this, Evan considers training at altitude to boost his performance for this section of the race. Analyse the immediate effects of altitude training on Evan's respiratory system. Pause this, give it a go. Answer, could get altitude sickness, so unable to train. That's hypoxia. Now, reduce partial pressure of oxygen, decrease in air pressure causes increase in breathing rate, which said at the bottom, partial pressure, so it's going through all of that process. GAPS DD, ADD effect there. Cardiovascular, additional factors, just fill in the gaps on these. So you've got those 3. What you should have is sudden arrhythmic death syndrome, high and low blood pressure, hypothermia, hyperthermia. I won't necessarily concentrate on these too much, because in January exam it was hypothermia, so I wouldn't concentrate on that at all really. Maybe hyperthermia, but potentially not even this at all, because it's in the exam in January. I doubt they're going to do it in the summer for people resitting, etc. Analyse the effects of hypothermia that could have on Freddie's cardiovascular system. Pause this, give it a go. That's the answer that someone gave in the exam with regards to this question. Finally, energy systems. There hasn't been a question on the additional factors of the energy systems yet, so I haven't got one for you. However, it's important you look back over this on your notes or on the PowerPoints that are available, and you know this, maybe especially this top one here. Look at that, because it may come up in the exam. It may just ask you to describe the impact of and on the energy system and so on. So the answers you should get, so pause it if you haven't already. Diabetes and hypoglycemic attack. Children's lack of lactate system. So that is it, guys. Your exam is on Monday morning. Hopefully you're going to be looking over this over the weekend. If you have any questions, please do not hesitate to give me an email, and I'll get back to you as soon as possible. Thank you. Bye.